Hello, and welcome to the Nurse Gazette. I am sad to report today that Miss Jacky O has passed away at the age of 32. The former Wild 'N Out model shares three children with comedian DC Young Fly. She passed away while receiving cosmetic surgery in Miami. It's being reported that the star was getting a mommy makeover. It is being alleged that the surgeon that performed Miss Jackie's O's procedure, the mommy makeover, is an Instagram surgeon by the name of the real Dr. Zach. The surgeon has since removed the picture seen here of him and Miss Jackie O from his Instagram page, and also he has turned off the comments. Now, it is very common for surgeons to post pictures with patients, especially if the patient has a large following on social media. This way, they can gain more followers, more clientele, and also showcase their work as a surgeon. So, what is a mommy makeover? The goal of a mommy makeover is to restore the shape and appearance of a woman's body after childbearing. The procedure typically includes 2 to 3 of the following procedures: breast augmentation, breast lift, tummy tuck, liposuction, labiaplasty, or Brazilian butt lift. Now, let's talk about what is a BBL and how it's performed. A BBL is a Brazilian butt lift. It's a surgical augmentation procedure that involves removing fat from one area of a patient's body, typically from the abdomen, hips, or thighs, and then injecting it back into the buttocks to add volume and shape. The procedure is carried out in several stages. The first stage is the fat removal stage. The fat is extracted through liposuction using thin cannulas, which are inserted into the body via small incisions. Stage two, fat processing. The extracted fat cells are washed, filtered, and purified. Stage three, fat injection. So the fat that was removed is then processed and strategically injected into specific parts of the buttocks to achieve the desired size and shape. So let's talk about some complications that can occur during or after the surgical procedure. As with any surgical procedure, BBL carries inherent risk and potential complications. Some of the most common side effects include bruising, swelling, and soreness at both the liposuction and fat injection sites. A major complication that can occur after surgery is infection. Symptoms of infection include fever, yellow or green discharge, and persistent redness at the surgical site. Severe infection can lead to sepsis, and sepsis is basically the body's extreme response to an infection. It is a life threatening medical emergency. Sepsis happens when the infection that you already have triggers a chain reaction throughout your body. To reduce the risk of infection, it's crucial to choose a surgeon that is reputable, who follows proper sterilization protocols, and carefully clean the surgical site as directed during your recovery. Here are some symptoms to pay attention to that may be related to sepsis if you've recently had surgery: uncontrolled shivering, a fever or very cold, extreme pain or general discomfort, pale or discolorated skin, feeling sleepy, difficult to rouse, and convulsed. I feel like I might die, short of breath. So if you're feeling any of those symptoms, please go to the ER or call your doctor. Another complication of surgery can be seromas. A seroma occurs when fluid accumulates under the incision site, leading to swelling and an increased risk of infection. Surgeons can reduce this risk by using drainage tubes to remove excess fluid. Patients can also help by appropriately caring for their incision sites during recovery. And that would also include wearing your compression garment. So, the compression garment is going to help with swelling and the formation of seromas, because what it does is that space that's created from the liposuction when they take out the fat the space between your skin and then your muscles. That in between space needs to be compressed to be able to mend back together, after surgery. So if you don't compress correctly or wear your garment, that space is left open, and what it does is it fills up with fluid, and it is very, very, very painful. So bleeding can also be a complication, and that is basically with any surgery. You run the risk of excessive bleeding. So the excessive bleeding at the incision site is another rare complication of a BBL surgery. Surgeons should carefully evaluate patients for any signs of difficulty healing and consider any medications that could increase the risk of bleeding. If you do elect to have surgery, the surgeon will typically, or they should be, giving you a list of medications to stop taking prior to surgery, because these medications could cause excessive bleeding during the procedure or even after the procedure, which could also be life threatening. So, a few of those medications definitely include aspirin, vitamin E, heparin, warfarin, things like that that will thin out the blood. One of the major complications that you put yourself at risk for when getting a BBL is fat embolism. So, a fat embolism is when one or more droplet like particles of fat enter your bloodstream and block circulation through some of your blood vessels. When this occurrence is severe, it can cause respiratory failure, neurocognitive deficit, and death. Another complication can be tissue necrosis. Now, they say that this is not really common, but when I look on the surgery pages on Instagram, I do notice that a lot of women they post about having tissue necrosis. So this happens when the surgical site does not receive proper blood supply, causing healthy tissue to die off. To lower this risk, patients should avoid contact with their buttocks during recovery, do not apply compression garments too tight, and quit smoking if they are smokers. So you can see here how this tissue around the wound has turned black. So basically, the tissue has died. So whenever you're putting on your compression garment, make sure you're not putting it on too tight. You can at least fit two fingers in between, or your hand, at least between your skin and the garment itself. It should not be so tight that it's cutting off circulation, because that will cause the skin to die in that area, which will cause a new wound that could possibly lead to infection. Although non-life threatening, unfavorable scarring is definitely something that is a possibility that could happen as a complication after surgery. Some patients may develop unsightly scarring as a result of the cosmetic procedure itself. Skilled cosmetic surgeons can minimize this risk by placing small incisions in discrete areas and recommending creams to reduce the appearance of scars.
It's possible for
Now
patients
let's
to
talk about
experience asymmetrical
asymmetrical
results following
results.
a
So
BBL
you should
procedure.
know that
This can
cosmetic
be due to
surgery
poor
is not
surgical
100%
technique, low
perfect.
fat cell
There will
survival
be
rate,
times
an
where
infection, or
you
failing to
have
follow
surgery
recovery
and
guidelines.
your results
In
are
some
not
cases, a
symmetrical on
revision
both
surgery
sides.
may be
It's
necessary to
possible
correct
for
the
patients
issue.
to experience
It's
asymmetrical
possible for
results
patients to
following a
experience
BBL,
asymmetrical
especially.
results following a
This can be
BBL
due to poor
procedure.
surgical technique,
This can be due
low
to poor
fat
surgical
cell survival
technique, low
rate,
fat cell
an
survival rate,
infection,
an
or
infection, or
failing to
failing to
follow
follow
recovery
recovery guidelines.
guidelines.
In
In
some
some cases,
cases,
a
a
revision
revision surgery
surgery
may be
may be
necessary to
necessary to
correct the
correct
issue.
the issue.
It's possible for patients to
Another common complication is sensation loss. While temporary numbness is common, a small number of people may suffer permanent nerve damage, leading to a loss of sensation in the buttocks. Surgeons can minimize this risk by using proper techniques during the procedure itself. Another common complication is sensation loss. So, in conclusion, one of the key factors in reducing the risk associated with any cosmetic surgery is selecting a qualified, board certified plastic surgeon. These professionals have undergone extensive training and are committed to performing procedures safely and effectively. Many surgery related complications occur when procedures are performed by inexperienced or unlicensed practitioners. Additionally, Patients should follow all pre and post operative guidelines provided by their surgeon, including quitting smoking, wear compression garments, and properly care for incision sites during your recovery. All right. And always remember, if you have questions about your health, call your primary care physician.
Oh my god, I'm going to be here for freaking hours. What the heck is that on his
This bus
pants?
got a little funny smell too.
Please call my name.